Hello, I'm Dr. Jerry W. Jones, the CEO and Chief Instructor at Medicus of Houston. I want to talk to you today about some ECG misinformation that I've found spread throughout the internet. This is a topic that I think you'll be very interested in and consider it a precautionary tale. So let's get started. Let me begin by saying that there are some excellent, reputable, dependable websites and YouTube videos about electrocardiography. Unfortunately, however, there are some that are produced by people who have little or no true understanding of electrocardiography or ECG interpretation. I've created a few short videos to give you a heads-up warning that you may be visiting such a site or viewing such a video. Today we're going to begin with a discussion of the mean QRS axis in the frontal plane. The mean QRS axis in the frontal plane in adults is from plus 90 degrees to minus 30 degrees. This is definite, it's absolute. This is the mean QRS axis. Now, many years ago, the mean QRS axis was said to be from plus 90 to 0 degrees. Since the mid-20th century, however, the mean QRS axis in adults has been, as I said, from plus 90 degrees to minus 30 degrees. Now, I found references to this as far back as the mid-1960s. That's 50 years ago. Let me repeat that. That's 50 years ago. Yet, you can still find websites today that will tell you that the mean QRS axis is plus 90 degrees to 0 degrees. Now, if someone hasn't updated their material in 50 years, do you really trust the other information that they may be feeding you? If whoever is presenting on that website or video introduces the concept of the mean QRS axis in the frontal plane, do they even try to explain what it means? What information it's giving you? Or even how to use that information? If so, you found a very reliable source. Continue on with that site or video series. But if not, someone is burdening you with information that is likely to be, at an introductory level of ECG training, rather useless information. Find another source that's actually going to teach you something. Now, in the old days, more than 50 years ago, to rapidly determine if the mean QRS axis in the frontal plane were normal or not, we would look at leads 1 and AVF. If the QRS complexes in both leads were net positive, upright, then the axis was in the then normal range. But the normal range for the mean QRS axis changed in the mid-20th century. So how do we now quickly check for a normal QRS axis? We look at leads 1 and 2. If both leads have upright QRS complexes, the mean QRS axis is normal. If lead 1 is upright and lead 2 is inverted, then left axis deviation is present. Now, one last pearl. A normal mean QRS axis does not help you with your assessment of a 12-lead ECG. It simply doesn't help. And why is that? It's very infrequent for a person with a normal heart to have a mean QRS axis outside the normal range. However, it's quite common for a person with a very diseased heart to have a normal mean QRS axis. So while an abnormal mean QRS axis strongly suggests a problem with the heart, a normal mean QRS axis really tells you nothing. Did you know you can learn more on my website? I'm Dr. Jerry W. Jones, and I teach master classes in advanced ECG interpretation. I teach the master class in advanced electrocardiography and the master class in advanced dysrhythmias. Both are 4-day live and in-person classes. Each master class is limited to just 20 participants. There's active participation by all in both classes and time to ask questions, even during the presentations. You can learn more about these master classes at my website, https://medicusofhouston.com. Thank you very much for your time and attention, and join me for the next presentation, Misinformation about Ischemia and Infarction. And before you leave, please subscribe to my channel and click that like button. Thank you very much.